At the Advocacy Center, we have a dual mission to provide supportive services to youth and adult victims of domestic violence, sexual assault, and child sexual abuse, and to reduce abuse in our community through prevention and education. Our youth services are focused on protecting children and teens through trauma-informed support and response services for youth and their families, and decreasing the risk of abuse through outreach, community education, and prevention services in schools, in the community, and with youth-serving professionals. We know that our youth services are important, necessary, and life-changing. I'd like you to hear from some of our program staff to learn more about youth services and how we're creating change in our community.
I think that everybody who's struggling, who has had trauma in their lives, should have support and help and resources when they're dealing with that trauma. So to me, it's very much a given in terms of like why youth services and the services that we provide matter. Our youth service program is about response, it's about healing, and it's about prevention. We provide services to children and teens who have been impacted by child sexual abuse, by dating violence perhaps, by domestic violence, by physical abuse. We work with non-offending family members of those youth. We work with adult survivors of child sexual abuse, all within our youth service program. We can all understand what it feels like to have somebody advocate for you, stand up for you, speak for you as needed, like when any of us are in a situation that we're uncomfortable with or we're afraid of or that is new to us, to have somebody right with us who can help explain that system. It's such a huge relief. I think we can all identify with what a relief it is to have someone help us like that.
I've been at the Advocacy Center for about 22 years. Most of that time, I've been part of the Youth Services team, and I am the Child Advocacy Center lead. It's so important for the child when they decide to tell someone that they are believed, that they feel safe and loved and protected. And it's also a big role or a big part of what I think we do is work with the supportive adult in that young person's life, because what happened to the child is also happening, in an indirect way to the adult. Trust, being able to trust folks again, being able to trust a relationship. A lot of times what we know is that, what's happening to a child is happening to them by someone, that they know and may have trusted. So that trust is broken, and it can really have an impact on all of the relationships that the young person can have. We have worked hard at providing a very safe and family friendly location with the child's interest. The best interest of the child is our primary goal here. I can think of a young person that we worked with for years, and when she was able to disclose and all the different parties she disclosed at school, and then we got a call from the school, and the school believed her and reached out for support, and then she got involved with the Advocacy Center, and she ended up going and staying with another family relative and has really thrived. You can remain anonymous. You can share what you want to share, what you don't want to share. If you want to get connected up with a youth services advocate and meet in person and meet one-on-one, that's a possibility too. That we can meet you where you're at. We can help you. We can help answer questions. We can help connect you with other resources.
I'm Andrea Champlin. I am one of the lead advocates at the Advocacy Center of Tompkins County. I've been there for about 5 or 6 years between volunteering and employment, and I have predominantly worked in youth services, mainly with teen survivors of domestic and sexual violence. They're often facing quite a few issues. It's rarely just one thing. So I work with teens that might be in abusive relationships themselves, teen dating violence. They could be struggling with at home with their parents might be in a domestic violence relationship. And then also folks that are kind of in that spectrum. So maybe they're struggling with, the sexting is a big thing that we're seeing a lot with the pandemic. So, and the sextortion of non-consensually sharing like revealing images of teens. That's certainly something that we see a lot. I want them to know that there are a lot of things in the world and in the media, in our very own communities, maybe even in their own schools or clubs that they're part of, that might make them think that some part of this is their fault, that some part of the abuse is their fault, or that, they should have said something sooner, so it's their fault that it continued. If I could leave them with anything, it is that there is nothing that would make it their fault at all.
Lynn Stack, and I am the Youth Education Coordinator, or sometimes the Youth Community Education Coordinator. And so the core of our youth education programs is really 6th through 12th grade and primarily health classes. I've done programs with English classes. Sometimes we're brought in for Social Justice Week at the high school, things like that, where there are other things that we can talk about, but they don't fit in the health curriculum. And also after school programs. And then what I love is over the last couple of years, we've been working with Youth Through Action, which is our teen activism group. We now do have a great newspaper article about it. Gaia's Circle, we're using the Girls Circle curriculum, which was developed by the One Circle Foundation. And it's really a strength, relationship, and resiliency-based curriculum for middle school girls. I want teens to know that we are here, that our services are here for them too, and that they don't have to have all the right words or know even what their questions are in order to be able to reach out to us. I often hear people say, I know these are important issues. I want to be able to talk with teens or with the students in my class, or to be able to answer questions when they come to me. And I'm worried that I don't have the right words, or I'm worried that I'm not going to do it right. It feels uncomfortable. And what I want them to know is that I completely hear that, and that we can help them get through that fear.